see the difference. If Marco wanted a bronze, or if you sold Marco a bronze plan. Let's see this bronze plans here. So let's take up silver actually. Because ironically enough, some silver plans might be better than bronze plans, and bronze is worse and it'd be more expensive. So let's look at an example here. So look, this bronze plan is $0, right? It's free, but look at the deductible. $12,700 for his family. Look at that out of pocket. $18,000. Remember, it was $3,400 on the other one. $18,000 out of pocket. The doctor visits is $40 after he needs a deductible. So essentially, every time if you sold on this plan because it's free, every time Marco goes to the doctor, he's not covered because it's $40 copay after he needs a deductible. So every time he goes, whatever the doctor says the consultation costs, 100, 200, 300, Marco's going to have to pay that because he hasn't met his deductible. Does that make sense? Now, something worth knowing, and this is just more knowledge based than something you'll probably be talking about a lot, but is if Marco took this plan and every time Marco went to the doctor, he had to pay $300, every dollar you spend does count towards your deductible. Okay? So if Marco had already spent $1,000 out of his pocket going to the doctors and doing things, and then he goes to the hospital and he has a $100,000 bill or a surgery, when they tell him, hey, you have a $12,700 deductible for me to save your life, you already spent $1,000, so it's only $11,700. Okay, deductibles are important because without deductibles, and most people will take a deductible of $2,000, $3,000, $4,000, $5,000. That's normal. For people that are working class, people that make good money, that maybe don't get plans really cheap. So you don't have to freak out if you have to tell a client they have a $3,000 deductible. That's common, but it's important that we understand the difference, and that most importantly that the client understands the difference. So just to make something very clear, our agency does not make more money if Marco takes a bronze or a silver. It's the same commission for us, regardless of whether that plan's $1,000 a month or $0 a month.
Yeah, very important point. That just so that you know, your performance is not going to be dictated or measured by what the client pays. The client can pay $0 or they can pay $500 a month. It doesn't matter. Your performance and what you're here to do is simply enroll and support and build relationships with clients based on behalf of our company. That is it. We want to put the clients in the best plan possible. We want to lead with Aetna and United Healthcare. Why? Because they're two really well-known names. They have great coverage options for the client, the states that we have the clients in. But if the client is adamant about going with Oscar or Ambetter because of a primary doctor or a specific plan, we do that. That's no problem. But that, once again, that's a great point by Joseph. It does not matter what they pay and what plan they choose, as long as we get them enrolled. That's what your primary job responsibility will be.
And that's a beautiful thing because now we get to really help the customer. Our job is to just educate them on what they're choosing. We're literally their advisor, just going hand in hand with them, picking a plan. That's all we're doing. Let's pick a plan together. This is based on what they're telling you, this fits your needs. Okay, let's choose it. If you want to change anything about the plan, give us a call. Plain and simple. You guys each will cover systems. I believe tomorrow's in the agenda. Each of you are going to have a dedicated phone line that we're going to give you, where there's going to be an extension that goes directly to you, so they can keep, they can stay in touch with you if they have to. That dedicated number should even allow you to text back and forth also. So we should be good to go from that end. But now that you see bronze and silver, why it's important, right? And there's other ones. I mean, there's a bronze plan here. There's $31 a month. It's not even free. And look at other stuff. When we were looking at an Aetna plan for Marco on silver, that was free. So it's weird the way they do it because some companies are just different. But it's important that we understand that. Okay. So let's go back to the other plan we were looking at, which was the silver. Let's get rid of the bronze. And let's dive in a little bit deeper into things that people are going to ask and things that you need to understand, right? So right here where it says plan details, because what you see here is just a summary, right? Boom, quick. No copayment for doctors, Mr. Customer, no copayment for generic drugs. What happens if I go to a hospital, if I get in an accident, maybe some people tell you, hey, I need to do x-rays next week because my arm hurts and they want to see if I broke it. Whatever the case may be, you know what I mean? We need to understand how to figure out what is what and what is covered. So when we get into plan details, here we're seeing the same summary that we were seeing earlier, right? monthly premium is zero, deductible is $0 per person or family. Out of pocket is $1,700 per person or $3,400 per family. Network type HMO. So remember, HMO means they'll need a referral to see a specialist, and it's a silver. Well, let's start going a little bit more in depth. So primary care visit, we already said there's a $0 copay. Specialist visit. How do I know it's a copay? Because it's a dollar amount, right? If this was a percentage amount, then that would mean that it's a coin insurance. So in this plan, Marco, he's diabetic, he needs to go see a specialist every month. It's going to be $10 every time he goes to see a specialist, flat fee, right? So that's good. You know, it's only $10. You're gonna get taken care of in and out. Preventative care, 90% of, honestly, I won't say 100, but let's just say 90% of plans that you're going to enroll people into, everything that's preventative is covered, right? There is a big initiative in trying to keep people healthy, making sure women prevent breast cancer, men prevent colon cancer, and do prostate exams, things of that nature. So preventative care is going to be always covered at no charge. Let's go into drugs that would be prescriptions, you know, la receta que te mandan so you need to get. So insulin, high blood pressure medication, metformin. So this plan is good, right? Because if it's generic, so let's say you're taking just a high blood pressure medication that is generic, every time that the doctor sends a prescription to the pharmacy, Marco can go pick it up for free. Let's say that it's a brand medication. That's when it starts getting tricky, right? I want to say that, and don't quote me on this, I'll find out by the end of the week, but like insulin is a common one. I want to say that falls under either one of the other three, but even here, like at the worst case scenario, it'll be covered for $150 if it's a really big end drug, which is really good. You know, when people start getting into more serious medical conditions, like I keep going back to cancer because it's a very common medical condition. There are certain pills that cancer requires that you take. They are super expensive. I've had plenty of family in Panama call us over here to try to get medication here because forget getting it in one of our countries, it's astronomically expensive. The most expensive medication they'll get here will be covered at $150, which is, you know, it's a relief because they know it's a dollar amount. It's not a percentage with this specific plan. And we keep going down. Coin insurance. Remember that we talked about coin insurance? Well, here we are. X-rays. If this is a person that literally says, I do blood work every month because I have a medical condition and they need to do blood work every 2 months, every 3 months for me. I wouldn't sell them this plan necessarily because it's free. I could probably get them a plan that they could pay something and this will be a copay. But if it's not, then I'll probably still go with this one because what does this mean? This means that deductible is zero, right? So the deductible piece is irrelevant. But for blood work, if I go to do my blood work to see, you know, my levels of whatever the cost of that blood panel, that blood work is by that clinic, I have to pay 25% of it. So if it costs $100, I pay 25. But if it costs $1,000, whatever it is, an MRI or something like that, I gotta pay 250. Does that make sense? So this is a perfect plan to cover both scenarios of copay and coin insurance. Because if Marco tells me, Joseph, my doctor has me on a plan where I got to go every 3 months and do blood work because I want to make sure that I regulate my high blood pressure and my cholesterol. And then we got to do it every 3 months. This is not a good plan for Marco. Because when Marco goes and finds out he needs to pay, let's say $80 every time, he's going to be like, I don't want this plan. You know, the one that my friend has a plan that she only pays $20 when she goes. Because you'll get a lot of that, you know? So it's good to understand what the needs of the clients are. And again, this is all going to be in the script that we're going to teach you guys that we'll send to you tonight so you guys can start studying it. And Friday is really going to be the day where we go into this and we go just crazy for 4 hours, just going through different types of scenarios and medical conditions and income and like guys that live with their grandma and their cousin and their little nephew. And like, we'll go through everything to understand how to cover it, you know? People that just got here from Colombia and we don't know what their citizenship status is. Like we'll go through everything on Friday. And that's how we'll start getting better at it. Today, again, it's just getting an understanding. But so far, I think you guys are following along, right? Nod your head if you are. Perfect. Scrolling down. Hospitals, right? Something very important that is good to explain to clients. There's urgent care and there's the emergency room. Okay, difference between urgent care and emergency room. If I have a fever and it doesn't go away, but it's not an emergency, but I want to go see a doctor, it is recommended that we tell the client, you tell me, if you get sick and you just need to go see somebody right away and your doctor doesn't have appointments, go to urgent care. Don't go to the hospital, to the emergency room. Why? Because if you go to urgent care, look how much the copay is. It's $5. But if you go to the emergency room, it's a 25% coin insurance. Just so you understand how hospitals work here, everything in the emergency room is billed. They charge you 10 times over. So I remember this happened to me. I went to the emergency room one time. I was younger. This is years ago, 22, 23. I just felt really bad. I had a fever. I was sick. I lived, I wasn't married yet. So I called my wife to help me. So I got in my car and I drove myself to the hospital. I was in the hospital for 30 minutes. This is all they did to me. They took my temperature. They put me on a scale to see how much I weigh, the regular things to do when you go to the doctor. They took my blood pressure. They sat me down. I waited 20 minutes for the doctor to come in. The doctor asked me, what is wrong with you? I told him what was wrong with me. He wrote me a prescription. When I got home, I didn't pay anything, right? My insurance had $0 deductible. When I got the bill, right? Because if you have 0 deductible, that 25%, you don't pay that day. They're going to send you the bill. They're going to send you an invoice. I didn't pay much because my insurance covered it, but what they charged for that visit was $2,500. Yeah, it's fucking stupid expensive. Excuse my French. You know? So what happens if we put somebody into the emergency room and they go not for an emergency, right? If they have an emergency, you got to go to the hospital. It is what it is. But they go because they had a fever and they get a $2,000 bill and they got to pay 25% of that. You know, that is $500 they'll have to pay for one hospital visit. But if they would have gone to urgent care, they would have paid $5. So these are the things that we want to explain to people. Don't get me wrong. If you have a freak accident and you need to go to the hospital, go to the hospital. You know, if you have a $0 deductible, they're going to help you free of charge. You're going to get a bill for the 25% of what you owe, and they can do paying arrangements and things for the hospital to work it out. It's important that they were covered, but it's important that we educate them on that. Ambulance, same thing. You have an emergency, call an ambulance. You know what I mean? If you don't have an emergency, don't go in an ambulance. And people, again, the people that live here understand this. Like, it's a known thing that healthcare is really expensive. So I've heard of, like, during the pandemic, people were passing away because they didn't want to go to the hospital because it was too expensive. Just to give you guys an idea. So it's already in our brain that I'm not going to the hospital unless I have to, but it's important that we just explain the difference to them. So, you know, if you need to stay in the hospital, in the facility. So remember when we talked about, like, if you got in an accident in the hospital for like a month, that month could be $200,000 worth of hospital bills. You only got to pay 25% up to your maximum out of pocket. So if Marco was in the hospital for 2 months, he got a $200,000 bill. 25% of that is $50,000, but the maximum out of pocket for Marco was $3,400. So that's all he'll pay, $3,400 for $200,000 bill. Does that make sense? You guys following along with me there? And it keeps going down, you know. Outpatient services, if they need to see like a mental health, or if they need to go to rehab for substance abuse, the guys that go into rehab, you know, it'll cover 25%. If there's outpatient, meaning that they go see them, it'll be covered. So there's different things, different scenarios. Pregnancy, everything for the baby here is covered. The actual labor, delivery, and like giving birth, 25%. So if she was pregnant, maybe I'll try to find something that has a copay, but a lot of things for pregnancy don't have copays. Mostly is coin insurance. That's normal. And that's pretty much it. You know, again, if you could dig here and find like a detail of everything, here's where you'll find plan details, right? So when you're searching for a plan for the client, obviously they're going to tell you what is important to them. Then we're just going to match that to the details here. And then that's how we'll make a recommendation for the plan. Plain and simple.
Joseph, so when we talk about what a primary physician, are we asking them, right? We're asking, hey, do you have a primary doctor that you use? That's really going to be the first qualifying question, don't you think, or no?
Correct. In the script, that is one of the first questions. So the two things that we want to ask off rip is, do you have any conditions? Like, because we want to know if they're going to use it a lot or not. And do you have any specific doctors that you rather see, right? We want to ask it in a way where, like, if you cannot see the doctor, you got to go somewhere else. But is there any doctors that you would prefer? And if they say yes, we got to get the name of the doctor. So Marco, give me a name of a doctor.
Let's do Jose Conde.
All right. So I talked to doctors. I talked to Marco, and Marco tells me I need to see Jose Conde. That is my doctor. I need to see him. If I don't see him, I don't want the plan. You know, he's been helping me for years. Here on the left, you can add a doctor. So I'm going to literally search Jose Conde. Now, something that I haven't gone over that is important that we understand. Their doctors are in what they call a network, right? So all clinics, everybody that has a clinic or a hospital, they register their clinic and the networks for the insurances so they can take that insurance. That's how they accept insurance, right? They register to the network. So let's see what network Jose Conde belongs to. Let's see if we can find Jose Conde. Is it this one here in Delray Beach?
Yeah, that one, huh?
All right, so Jose Conde, let's go done. So now, for example, Aetna, he doesn't take this plan. Okay, so we'll start scrolling down, looking for somebody that does. Which let me see if I'm limited to Aetna here. I am not. So let's see if we have somebody that takes. Some doctors don't accept any plans for the marketplace, just for the record.
Yeah,
right?
and that could be a bad example because I'm not sure
Right,
if
'cause that's your brother, right?
my brother takes any plans for the marketplace. One thing you'll see is if someone says, yes, I do want to use a specific doctor. This doctor 9 times out of 10 will be somewhere in this search because they're coming from an existing Obamacare plan.
Yeah.
So you know, this
Let me
won't
change it.
happen.
Let me put
Change
I think I'm gonna put I think I know the name of my doctor. Hold on. And I know he takes it. Let me see if I can find it. Let me try it like this. That's why. Yeah, Beatriz Huarte, that's a dentist. All right, let me just put my old doctor, because I know he takes it for sure.
Jose Mena put one there.
Carlos Vallejo. Okay, let me say Carlos Vallejo. Now we'll go back to the one Jose Mena put. Boom. All right, Carlos Vallejo. So let's see if Carlos Vallejo takes any of these insurances. And for the record, neither me or Marco have any of these plans. So probably our doctors might not even take it for all we know. So again, let me search on one that, again, most people are gonna have a plan that's here because they are already in the network, the clinics they go to.
Correct.
What was
yeah.
the name that you put in the chat?
It was, yeah, Marlene, Marlene.
Tagwes, got it. Marlene.
Mhm. And then, yep. Mhm.
Am I showing the other last name? Cordova. Yep, here she is.
Good.
They're both the same, yeah. So when I add her, let's see what we got. Yep, here we go. So she takes Oscar. So off rip, I know she takes Oscar. So maybe I have to go with Oscar in this event. Remember we talked about one of the scenarios will be if they go with Oscar, if they have a doctor, I'm sorry, this person, okay, perfect. So here I have one. Your deductible $35 a month. No copay for doctors and generic drugs. Everything else will probably be really good too. So that's how you find what doctor they accept. If they don't find the doctors, then we can just find them. Again, these are based on zip code. If these plans are popping up in Marco's zip code, it's because there's a lot of doctors in that area that take the insurances. It's important that we understand that too. But that's how you add a doctor to see if it's covered. Questions?
And Joseph, would you say that you know, a lot of clients won't have a primary doctor?
Most of them don't.
Clients, most of them don't. They're just gonna say, yeah, I go to the urgent care clinic whenever I get sick and see whoever's there. That's what most people do. Most people don't have a specific primary doctor. But if that you do come across that, that's how you would search it and that's how you would match it up.
And here's the thing, just so you guys know, remember, you're gonna have a number that you could dial anywhere in the United States. If you have a client that says, I go to a clinic and we can find the clinic by name, we can get the number of the clinic and call the clinic. And be like, hey, I'm with Fulanito, we need to know what insurance you accept from the marketplace. And I'm like, oh yeah, we take Ambetter, you know, the EPO. Perfect. Now we know it's Ambetter because sometimes since it's the beginning of open enrollment, they won't update this. So for example, a lot of we might run into this a lot because if the clients we had in Bright, a lot of people took Bright as the only insurance. Now they just had to go and register the clinics for all the other ones because Bright went away. It might not be reflecting on time. So there might be scenarios where you guys are with a client and we're gonna call the clinic they go to every month or once in a while, just to ask, hey, what insurance are you accepting now that Bright is gone from the marketplace? Oh, no, we're gonna accept Oscar, we're gonna accept whatever, Molina, which these are companies that we'd rather not sell, but if we have to, then we will. Does that make sense? All right. Let me kind of run you through what a process of you enrolling somebody is gonna look like. You're not gonna physically enroll people. We have a team that does that. But when you call these clients, right, we need to find out what type of coverage they need. If they have any medical, we do that by what conditions and do you need a doctor? Based on that conversation, that's going to elaborate enough where we'll know, okay, they need something that is silver, they might need something that is bronze. Once you get them to agree, okay, I am going to show you tomorrow a form. It's a very simple form that you're going to fill out for us, where you're going to put the client's information. With that form, my team is going to process the application. Just so you guys understand. Okay, so it's a very simple form.
Yeah, we've really tried to make it as simple as possible for you, okay? Because the enrollment process is a little bit complex, okay? The enrollment process is so what we're doing is we want you to be able to best use your time, which means reaching out to your clients, getting them re-enrolled, fitting them and qualifying them into the correct new, Obamacare health plan, and then from there you simply filling out a link that we're going to be sending you. That's probably going to take you 2-3 minutes to fill out. Very, very quick, very easy. That information is going to come back to our home office. Our home office then is going to do the processing for you. So really, once again, all we're looking for you to do is reach out, get in contact with the clients, build a relationship as their local, as their health advisor in their transition, moving away from Bright into a different company, help them pick the next company or help them, get right fitted into qualifying them into the right new healthcare program. And then simply from there, fill out the form that we're going to give you, send a follow-up email, which we're going to train you on as well. And that's it. And your job is just to build a relationship with the client, and just be there for them if something comes up. But that pretty much in a nutshell is what we will be focusing on during the project.
All right. So I have some homework for you guys, because obviously I just did an introduction in a sense on what Obamacare is, how to get into the marketplace, how to understand, how to quote in a sense, right? The difference between the income, the household sizes, some of the terminologies on EPO and HMO or silver and bronze or co-payment, deductibles, coin insurance, maximum out of pockets. Obviously, it's a lot of information. I know you guys have been taking notes. You're not gonna, if I quiz all of you right now without your notes, you won't know it, and that's okay. The homework you guys have is everybody has this HealthSherpa website. We're going to send you guys the deck that we went over. Okay, we're going to send you guys a zip code here in Florida, along with a scenario, age, health, just so you guys can literally start playing with the plans. And Marco, if this is okay with you, and this is just not a one-time, but an initial exercise, I'd like to send to everybody that we got on here a scenario of come back to me with what plan I should get. You know what I mean? Don't worry too much about price, more so about the solution, right? Where we want to be right now today is all about how do we find the right solution. Then price will be based, every client wants to pay, but I think that's the best thing for us to do, rather than just going in circles and continue to overwhelm you with information. Obviously, we put 4 hours aside for this training today. We've been at it a lot less than that. But again, today was an introduction. I know we covered a lot of things. So if it's okay with everybody involved, your Marco, specifically you, I know you're communicating with them through a group chat, I believe.
Yeah, which I'll add you guys to it now, yes.
Okay, add me to the group chat. Everybody that is here now, I'll give you each a different scenario, age, medical conditions, everything you need to quote. And then because tomorrow's training is just systems, Our really long in-depth training is going to be Friday, but I'm leaning towards just starting right away with the scenarios. So then Friday is just how much better can we get at this? So tomorrow, what we'll do the first hour is each of you will tell me what solution you found me. And I will tell you if you got it right or wrong. If you got it wrong, that's okay. We'll just get better at it. If you got it right, good for you. We'll keep practicing. Is that okay with you, Marco?
Yeah, that
And
sounds
it's
good.
a lot more interactive going forward rather
Yeah.
than just me.
Yeah. And we're gonna send a recording of this as well. So you'll have the Obamacare PowerPoint, the recording, and then we'll be sending you obviously the script as well this evening, so you have time to practice it. And also we'll send you the scenarios that you guys can all practice on, and then we'll role play through those scenarios tomorrow.
And just to kind of wrap up what we've gone through here today, just circling back to the opportunity we have in our hands. Something that Mark was very good at explaining everything, but he doesn't talk about himself enough, and he should. We have an opportunity right now where we're gonna get this right, because there's not if we get it right, we're gonna get it right. You guys are very smart, educated people. The fact that you've learned English, that you speak it well, that you could understand everything I just said. I could see you guys engaged, so I know you guys are following along with me. Means that we could possibly be in business for a long time. And one thing about Marco and about myself, we are very generous. If you are doing your job correctly, we'll make sure that you guys are good. So it's a relationship that could be very fruitful for both of our ends, right? We want to make sure that we can give the business to you guys, and you guys want to make sure you can keep the business, right? That way you can have work for a long time, and we have certain bonus structures in place, or additional bonus structures are going to be coming down the pipeline. Once we go from enrollment to retention, that's going to be bonusable as well. So you guys will have the ability to make some very good money if we are able to get this right. So I only say that because I want to make sure you guys know that this is a legitimate project. This is an idea that we came up yesterday, and he said, oh, let's go hire some people in Colombia. No, this is a real project. There is a lot of effort, a lot of money being put into this all around. We could do this for a long time, and we have all the pieces in place. You guys are an important piece. We're going to do everything in our power to teach you. We just need your part trying to learn. For example, the exercises we're going to run you through today, that you guys actually take the time to try to get it right, that you go back to the recording so you could actually do it, get it right. Don't just do it for 5 minutes and give me an answer. It's not, like you would do with a regular homework. Like, try to get good at it, because we could literally make a lot of money for a long time to come. And I'd hate to see some of you waste that opportunity, because I think everybody here is very bright and has a chance to really work with us for a long time.
Yep, agree. I'm excited, guys. It's just, and listen, to be quite frank, we'll know who's putting forth the effort or not. If you're putting forth the effort and doing the homework and engaged, we'll see it. And if you're not, then you're not. But once again, we are looking for the best of the best. And we want a long-standing relationship with our employees, but I want you also to think of yourself as a business partner, because everything as we grow our business, that gives us more opportunity to give you guys more bonuses and consistent work and so on and so forth. So that's the beauty of it.
Okay, Marco, that's all I have on today's agenda, man. I know that I ran it a lot quicker than I thought I would, but
yeah,
let's get that exercise out to the guys and the girls so they can work on it. I'm probably going to tweak the agenda a little bit, because I think that we can run with this a lot for systems. The systems you're going to use, I mean, this is one of them. The ones to call, I could teach you that in 30 minutes. It's not rocket science. I think the most important thing of everything is learning, because even the script, it's a conversation. Obviously, the script's going to be good for you guys to know what to say, like how to get into certain things, how to overcome certain objections. But if we don't get this right, like 80% of it is not understanding this stuff, because people, confidence on the phone, yes, it's tonality, is how you speak. That's all important, but it's knowing your stuff. If you don't know your stuff, they're going to know, and then not going to be confident in re-enrolling with us. And then we lose that client. And obviously we don't want that. So I'll tweak the agenda with you, bro, after we get off this call. I'm going to work on setting, how many people we have on here right now? Let me see. I'm going to stop sharing my screen now.
Yeah, we got a total of 11, including
11,
us.
that counts. Yeah, so probably like 7 or 8 guys.
Yeah.
That
Mhm,
that is
7 or
out
8.
to me.
Yeah.
Let me picture.
And yeah.
of-
Mhm. And also, if you guys want to jump into the afternoon training, we're going to do this again in the afternoon. So you're more than welcome to rewatch this one, or just jump in, because we're going to be doing it twice a day, the same kind of training block.
Yep. Question for you guys. Is it the same time as here right now in Colombia? I know it changes half the year in there. So now
1 hour. 1 hour.